I have the pleasure of having Dr. Mufaddal Hamadeh, who is the clinical assistant professor in University of Chicago. He is board certified in hemo-onc. And I also have Dr. Bassel A Atassi, who is also a clinical assistant professor in University of Chicago. And he is board certified in internal medicine and hemo-onc specialist. And he works at OSF, Little Company of Mary. Both are members of SAMS, the Syrian American Medical Society, and Dr. Hamadeh is actually the president of the organization. What types of cases are you seeing now?
The COVID presents a particular challenge for us, given the fact that many of our patients are immune compromised. So we try to limit exposure to some of those most vulnerable patients when they come into the office. And so we try to pick the patients that really need to be seen. Basically, those are the patients that are currently receiving chemotherapy. And some of those patients we are trying to delay their chemotherapy. And the whole goal is to protect the most vulnerable patients.
Thank you. This is a good way to ask Dr. Atassi. Can you also illustrate that? How did your work change because of COVID-19?
Absolutely. We come in the morning and there's no more clinics most of the time. What we do, we do now telephone visit and virtual consults. We try to protect people, keep them at their houses, and we just do telephone visits. Now, my work also involved a lot of inpatient care. My hospital is one of the busy hospitals who take care of the COVID-19 patients. And as hematologists, we're pretty involved in seeing these people. And because they have blood disorders, they have low blood counts, they have sometimes thrombosis and blood clots. And also our cancer patients, sometimes if you get admitted to the hospital, they have to be seen. So we see them and we care for them in the hospital. Now, as I said, there's a lot of virtual consults. Even when in the inpatient in the hospital, we don't see COVID patients face to face. We try to minimize the number of providers who see the patients, usually one provider per patient. So us doing consult and seeing patient make recommendations without seeing the patient examine them, this is the big change. That's new to us. Now we walk in the hospital with all the masks and the PPEs on our faces. This is also a big changes in our practices.
Thank you for answering that question. Dr. Atassi, it looks like your work has changed quite a bit because of COVID-19. So what would you say the biggest challenge that you have faced so far?
The biggest challenge that, now patients, we see them lonely. Cancer patients are very special patients. They're vulnerable. There are patients who need special care, need special psychological care. And now they come by themselves. There's no visitors. There's no company. Even if they get sick to the hospital, there's no one can follow them. Now, us also to protect ourselves. This is a big challenge. We're all human beings. We have family. We have kids. So us to be protected and protect ourselves is a challenge. So we do our best to do that. I do continue to care for our patients, which is our duty to do. So our whole life, how we live and how we wake up and this is all became like a different in this era of COVID-19. So the challenges are a lot of challenges between patient care and between also how we care for our patients inpatient.
Dr. Hamadeh, could you also explain what has been the most challenging part of your work?
The biggest challenge is basically that you need to be part of the solution, not part of the problem. As Dr. Atassi mentioned, we need to make sure that we stay healthy, and because we are seeing those vulnerable patients, we are in contact with them, more direct contact. So if you get infected, you are going to transmit this to your patients. So that really puts an extra responsibility on you to make sure that you take extra precautions not to be part of the problem.
What has been the rewarding part of your practice during this pandemic, and what is your recipe to keep going and to keep being positive during these uncertain times?
Okay, so the most rewarding part, honestly, in this pandemic that everybody mentioned that healthcare workers on the frontliners for sacrificing their life to provide whatever they could do to save these patients in the pandemic. that the whole world is facing. And it's give us a pretty big privilege that we are these healthcare workers. We are kind of trying to be on the front lines to help as much as we can. This is what we signed up for when we start to go to medical school, and that's what we continue to do. And it's our privilege to continue.
Dr. Hamadeh, my question to you is, do you think that in the field of hemo-onc, do we have good data about patients and how the disease is acting on patients who have cancer? Do you think that cancer patients are more susceptible to COVID-19 than the normal population, for example?
We know that people who are older, people who are sicker, basically have COPD, have lung diseases, diabetes, hypertension, they are much more vulnerable. Their prognosis is much worse, and they're much more vulnerable to complications from COVID. Cancer patients are no different. Most of them are older. They are immune compromised. They are on, they have cytopenias, and they have other comorbid conditions. Most of them have either diabetes or hypertension or other situations or renal failure. So definitely, the cancer patients are going to be at a much higher risk from the complications of COVID. Statistically speaking, they are less prevalent than patients with hypertension and diabetes and other patients. So statistically, they may not comprise a large number of the fatalities because statistically they are not as common as the other diseases. But definitely cancer patients do carry a significant amount of risk when it comes to COVID, because a lot of them already have, especially lung cancer patients, already have COPD and other comorbid conditions. Most of them are older also.
Is there any specific recommendation that you would give to cancer patients?
Of course. So cancer patients, as Dr. Hamadeh mentioned, they're immunocompromised, especially people who have active cancers and they have treatment on immunotherapy or chemotherapy or even targeted oral agents. So they all may have immunocompromise, may have low counts, and they're more susceptible to get the COVID-19 infection. And all the families, I'm very happy to report that my patients, like all their families, they're understanding and they're very supportive, and they try their best to keep their parents or their siblings very protected. So absolutely. And if the patient end up need to be coming to see a physician, we try our best to do it on the phone. We tried our best to avoid them come to the ER. And if they need to be admitted, I have done this a couple of times recently. We try to avoid the ER. We do something called direct admit. So from the home to the hospital, so we can avoid going to the ER. So avoid as much as we can to have any contact with sick people.
Thank you. So as you said, your practices has changed significantly because of COVID-19, and our patients have been spending much more time now at homes. Dr. Hamadeh, is there any specific thing that you would say to people who are staying more at home, who have been practicing social distancing?
For cancer patients, that is definitely the right thing to do, to stay at home as much as possible. We have implemented a few other measures in addition to what Dr. Atassi mentioned in terms of when people come to the office, especially when they have chemotherapy. We screen every single patient before they come into the office. We call them personally. We make sure they're doing okay. They don't have any cough or fevers or any symptoms that could be related to COVID. If they do, we tell them to stay home and not come to the office. And we continue monitoring them on daily basis. As far as the patients, staying at home, but it's not only enough to stay at home. They have to really abide by certain social distancing rules, particularly not seeing family members sometimes, and have to be at home, for a very significant amount of time. That imposes some social problems for cancer patients, especially elderly who are used to seeing their families and get their family support. But they, in most parts, understand, and most of them are very concerned. They understand what it means to get COVID at this point, and they know that this could be life-threatening.
Thank you, Dr. Hamadeh. Dr. Atassi, I'm sure you have been, seeing cancer patients. Cancer unfortunately do not stop because we are staying at home. Is there any specific recommendation for patients who are newly diagnosed with cancer, or to be more specific, for patients who has been diagnosed with cancer during this pandemic? Do they have any specific recommendations? And also, is there any message for the family of those patients?
Very good question, Bassel. It's very challenging that when patient diagnosed right now with cancer, seriously, you cannot tell them, okay, I see you back in 2 months. We're in lockdown. I mean, if somebody has like early stage, they may become late stage. If somebody has, for example, stage 3, they become advanced metastasis. So the delaying treatment, delaying workup, unfortunately, is not applicable to many people. Some cancers, easy, benign, some early stages, very early, you can wait for a few weeks. But many people, you have to do their workup, they have to do their scan. It happened to myself that I had to start somebody on chemotherapy in this pandemic because I know they're not going to do well. Even people with sometimes with advanced stages, they have symptoms. If we don't do treatment for these people, they become more symptomatic and become going to the hospital for their symptoms. So trying to suppress their symptoms, improve their pain, improve their cancer, and avoiding any progression. So it is challenging, but unfortunately we have to deal with the challenge and we have to come up with solutions. We cannot just delay them. Their families are, as I mentioned, family are very understandable and they're very supportive, and they get unhappy that when we tell them we need no visitors. So we try to help them over the FaceTime. It happened to myself that a patient here, I'm with her, and her sons are on the other side at their houses on FaceTime, and we're discussing. Very, very supportive families, and usually we try the best to keep the bond between the cancer patient and their family.
A couple of words to elaborate on what Dr. Atassi just mentioned earlier. Taking care of cancer patients is a huge responsibility. It's life and death decisions. And now more than ever, it's really a lot more challenging because you are trying to manage the risks between treatment and no treatments and what kind of treatment you give them. So it is true that we sometimes have to start treatment under these certain circumstances, but we also have to be careful with our choices of treatment. Usually there are several choices of treatment. We may delay surgery till after initial chemotherapy, or we may give a less toxic regimen initially, or even between the regimens, we may pick the regimen that we think could be better suited for this type of environment that we're living in. So it will require a lot of thinking, a lot of considerations when we make those crucial decisions.
Thank you, Dr. Atassi and Dr. Hamadeh. You are our champions, you are our heroes, and I cannot thank you enough for first taking the time to come and speak with me during your very busy schedules and days, and mostly for everything that you have been doing. You are our frontline fighters. We have all faith in you, and I cannot thank you enough for everything that you have been doing.